Indeed, taking care of elderly is very important. To learn more on the forum that was held this morning with us live on telephone call is Dr. AlSinawi, Senior Consultant Psychiatrist in Sultan Qaboos University Hospital. Dr. Hamid, good evening to you and thank you for joining us.
Good evening, Abdullah, and thank you for the invitation. Thank you.
Thank you very much. Now, addressing the ethics of elderly care is crucial. Could you briefly share how the forum progressed and highlighting the key areas of concern?
Yes, so the forum started by addressing the changes associated with growing to old age. We discussed the different health situations, different medical conditions, psychological and the social changes that comes with aging, and how these age changes can lead to certain ethical conditions. You mentioned, for example, the dignity of the elderly person. Mm-hmm. To what degree should the person be allowed to make decisions about their health? How much should the family interfere in such decisions? Because sometimes the family, because they care about the emotional state of the patient, they would, for example, ask not to tell him the diagnosis if he has or she has a serious condition like cancer, for example. We also discussed the different health and social services provided in Oman, the growing number of the elderly in Oman, and how these challenges can be translated into different care facilities. We had a panel discussion discussing who should be participating in caring for people who have no family to look after them. Do we need to expand the long-term care facilities? Would there be any better solution, for example, adopting an elderly person so he or she can live within the community, be looked after by extended family members or member of the public without having to send them into institutional care? Mm-hmm. We also talked about the different ethical situations related to caring for somebody who might have no capacity or not have no ability to make decisions related to her or her health or her health condition, and what is the role of the society in all of that.
Mm-hmm. Mm-hmm. And how will the forum discussions be translated into actionable policies to improve elderly care services?
Yeah, so the forum concluded with certain recommendations focusing on different elements, for example, increasing public awareness about the elderly, the needs of the elderly person, the different services that can work together. We also discussed educating different NGOs who participate in providing services for the elderly, the volunteering group. How do we educate them about the ethical condition they are likely to face? We also talked about developing clear ethical guidelines that involve caring for an elderly person in different institutions, being social institutions or health institutions. Also educating member of the public about the different changes in terms of when a person loses capacity to look after their financial interests and how to protect the elderly from abuse and embezzlement. And we also talked about expanding services, different services in terms of maybe investing on a daycare service where a person can be looked after during the day, have better access to community services, reduce the risk of loneliness, because loneliness is a big endemic. It's a big issue affecting the well-being of the elderly. So a day center will help in that.
And now, what steps can government institutions take to collaborate more effectively with families and communities in enhancing elderly care?
Excellent point. Collaboration is key here because the elderly tend to be cared by different institutions. Aging is not a medical condition, so although health services are involved, the social services are also involved. Legal institutions are also involved in providing and shaping policies that protect the elderly. We talked about encouraging community involvement. So the action does not only rely on the government, but also encouraging volunteers group, more social involvement in terms of providing services, looking at how to improve access to care. So people who have no family to look after them, then they could be looked after in a way that provides their dignity and saves them from abuse.
Great work there, Dr. Hamid. This definitely elderly needs to be taken care of. This forum on ethics of elderly care has established a strong foundation for improving elderly care services by fostering collaboration among government bodies, families and communities, and implementing the forum's recommendations, that we can ensure our citizens receive the respect and care they deserve. Once again, Dr. Hamid, thank you very much for giving us the details on the forum.
Thank you, sir. Thank you.
Thank you. That was Dr. Hamid AlSinawi, Senior Consultant Psychiatrist at Sultan Qaboos University Hospital.